We are going to go ahead and get started. Let me get rid of this. Okay. All right. Tonight, welcome everybody. My name is Sue. I am the program assistant here at the Elmhurst Public Library. Tonight, we're going to be using a hybrid format. And so that means that we have attendees both in person and online. If you are watching from home, we're using the webinar format. And that means you can see and hear us, but we cannot see or hear you. We're going to have a question and answer segment at the end of the presentation. If you're watching on Zoom, you can submit your questions at any time by entering them into the Q&A or the chat. If you are in person, please hold your questions until the end. On Zoom, we have enabled the live transcript option. If you would like to disable the words at the bottom of your screen, click on the closed captioning button. If you do not see the button with CC, click on More or the button with the 3 dots and then select Hide Subtitles. In the library, we have our assisted listening system. If you'd like to borrow one of these devices, just ask me in the back of the room. They're very easy to use. We'd like to remind you that everyone in the library is required to wear a mask and keep it on at all times. Please also silence cell phones or any other devices. And I would like to tell you a little bit more about our presenter this evening. Rick began his career in senior housing placement by purchasing an assisted transition franchise with his wife Pam in 2012, which was later renamed to Senior Solutions. During this time, Rick has developed a vast amount of knowledge as it pertains to the senior housing industry and is recognized as a leader in the industry. Rick has played a pivotal role in the industry, serving on the boards of several organizations, including Association of Senior Service Providers, ASSP, Naperville Lyle Triad as secretary, and Continuity of Care Alpha Chapter current president. Rick has also been thrilled to be a sponsor at several Alzheimer's walks. Prior to joining the senior industry, Rick has several leadership roles with retail organizations, including Jewel Food Stores, Cub Foods, USA Baby, and Toys R Us on local, regional, and national levels. Please help me in welcoming Rick Graffagna.
Well, hello, everybody, and not only to the people that are, I'm really thrilled. I haven't spoken to a live audience in quite a while, so both to my virtual audience and my audience that's right here. So I appreciate everybody taking some time out of their busy schedules, and especially for those of you that came to the library, you know, braving the cold weather to get here. So again, you know, as Sue mentioned, my name is Rick Graffagna, and my company is Senior Solutions, and tonight's topic, you know, it's about a 3-hour seminar, so hopefully you've set aside some time for me. But we're just kidding. 1 hour. So we will jump right in, you know, to talk a little bit about senior housing. And just as a reminder, as Sue mentioned, if you do have any questions, you know, here in the live audience, jot them down as a reminder for yourself. And for those of you that are at home, you can put those questions into the chat or the Q&A, and we'll get to them at the end of the presentation. Okay, so if you don't mind, I appreciate if we start maybe with a little humorous story. And I'm kind of sensitive, so if you could laugh, I'd really appreciate that. So there was this group of senior citizens that went on a bus, an excursion, and they were on a bus, and they had left, and they were out driving for several minutes. And one of the female passengers approached the bus driver and said, "Do you like peanuts?" And the bus driver said, "Yeah, I really do. I enjoy peanuts." And she said, "Well, that's great. Reach out your hand." And so she gave him a handful of peanuts. And a few minutes later, you know, she walked up, tapped the bus driver on the shoulder, and repeated itself. And he took the peanuts. And so this repeated itself like 3 or 4 times. Finally, the woman was speaking to the bus driver, and the bus driver said, "You know, I really enjoy the peanuts, but I really don't want to eat all of your peanuts." And she said, "Well, that's okay. The peanuts are too hard on our teeth, you know, for us to chew them." And he goes, "Well, if they're so hard on your teeth, why would you buy peanuts?" And she goes, "Well, we really enjoy the chocolate on the outside." Sorry. You can repeat that. So let's jump right into it. Okay. So we're going to talk a little bit about senior housing 101. Audio seem to be okay, Sue? Okay. So the first thing I'd like to chat about for for a few minutes is retirement community financial models. Okay, there are three different types of models I want to address. One would be considered buy-in. So does anybody here that's in the audience, are you familiar with buy-in? Have you heard of that before? No? Okay. So a buy-in type of senior community is one where there's a fairly significant entry level required in order to gain access to that property. And when I say significant, some level of six-figure amount of money could be a couple $100,000. It could be, I've seen as high as a $500,000. So depending on the size of the property and the location and what size of the apartment, and depending on the community, will impact what the amount is. So you might say to yourself, well, why would I want to do that? Okay, so here are some of the benefits of a buy-in community. One, it gets you access to live in this community. It gains you access to some of the other levels of care that are available, which I'll speak to in a few minutes. Sometimes that access is from a prioritization standpoint. So you take precedent over someone perhaps coming in straight off of the street. Sometimes there's pricing advantages and benefits to the buy-in model. Typically, when you do your buy-in, there's a percentage associated with it. It might be 90%, it might be 80%, could be 50%. And what that means is that at the time of you leaving that community, whether you're there to the end of your life and you pass away there, or you decide to leave under your own volition, that percentage of that initial upfront fee is either given back to you directly or to your beneficiary. So for example, if it was a $200,000 buy-in and it was a 90% buy-in rate, $180,000 at the time that you left would be relinquished back to your estate. Okay. Another thing that's a kind of a one of the benefits, not available in all properties, but in quite a few of them, they come with what they call a life care plan, where there may be a benevolent fund or a safety net, which essentially says that if at some point you no longer have the financial wherewithal to pay the monthly fee for the apartment that you're living in, you can stay. Okay. And so instead of maybe having to move out or to maybe transition to Medicaid to be the payer for you to stay there, that life care plan or that benevolent fund will allow you to stay living there. Okay. And again, if you have any questions about that, feel free to jot yourself a note or put it into the chat. The next type of financial model is what I call a rental or a community fee type of property. Here, there is an entry fee, but it's significantly lower than the buy-in. Okay, it might be $2,000, $3,000 or $4,000 in terms of the level of money that you need to pay as a one-time only non-refundable piece in order to gain access to the property. And then I call it rental because you really have a lot of flexibility, I guess is the way to phrase it. So you may sign what looks like a 12-month agreement or term when you move in, but you've got flexibility. In the state of Illinois, you can give a 30-day notification to your community, and that 12-year term, there's no come to an end. So there's no financial responsibility going to the end of the agreement. So for example, if it's not like your typical market rate apartment where, if you move in June and you decide in October you need to relocate because of work purposes, well, they're going to say, well, that's fine, you can move, but you're still responsible for the rent. In senior housing, if unfortunately someone passes away or circumstances dictate that you need to leave, you can give a 30-day notice, and that financial responsibility that you have comes to an end. Okay. And then next is low income or affordable housing. Here, there's really not an entry fee, but for affordable housing, the rent is in many cases determined as a percentage of your income. And pretty much, for seniors only. Typically, there's one level of care, not a lot of services. One of the challenges with affordable housing is that there's just not enough of it. The demand is really, significantly higher than the inventory or capacity. And in many cases, these affordable housing options, there's in some cases pretty significant wait lists. Okay. So let's keep moving. So different types of senior communities. One would be what we call independent living. All right. So an independent living apartment typically is unfurnished. So you bring your own belongings into the apartment. Could be a studio, could be a 1-bedroom, could be 2-bedroom, in some cases a 3-bedroom apartment. They come with full kitchens. And the reason you have a full kitchen is that there is a meal plan associated with these apartments, but typically the meal plan is less than 3 meals a day. It could be 1 meal a day, could be 2 meals a day, and whatever meals are not you're not eligible for to eat in the dining room in restaurant style, you can prepare in your own apartment. Or if you just feel like cooking in your apartment, you can do that. Your base rent for your apartment includes, takes care of the meal plan, takes care of things like housekeeping and maintenance and utilities and Wi-Fi, in some cases, the landline phone, local transportation, any of the activities and programming that takes place in the building, that's all kind of included in that base rent. Okay. So next, excuse me while I take a quick drink of water. Next is what I call independent living with services. So now you're living in your independent living apartment. You furnish it with all of your own belongings, decorated appropriately, and life throws you a curveball. Okay, so let's say you fall and you injure yourself, and now perhaps you're a little unsteady stepping into the shower, or perhaps you injure your shoulder and you're not as capable of dressing and undressing yourself as you were before. When that occurs, you can bring in additional services to come in and help you with what we call an ADL, or activities of daily living. Who's heard that term before? ADLs? Okay, great. So ADLs are things like bathing and dressing and grooming and assistance with toileting, medication reminders, things of that nature. So when you're in your independent living apartment and perhaps you have need for some support or help with a specific ADL, you can have that service brought to you. There's an additional fee. In some cases, you may need to contract with an outside caregiving agency to come in and provide that help. In some cases, it's an employee of the property that you're already living in that can provide that assistance. The key is that as long as that help can be scheduled, then you can continue to live in your independent living apartment. So that's an important concept. So you can schedule a shower assist. You can schedule when somebody needs perhaps to be help with getting dressed in the morning or undressed at night. If someone needs some mobility support, maybe to get from the apartment to the dining room for meals. Those are all things that can be scheduled. Okay. Once the type of help and the frequency of the help transitions to where it's truly more 24/7, then we're talking about needing to be in a licensed assisted living apartment. Now, an assisted living apartment, in many cases, is going to be in the same building where your IL apartment is. Could be in a different building. Could be on a floor that's designated for assisted living. Could be a different wing of the property that's designated for assisted living. You have your own apartment. Could be a studio. Could be a 1-bedroom. In some cases, a 2-bedroom apartment. Again, they're typically unfurnished, like your IL apartments. One big difference between an independent living and an assisted living apartment is in an AL apartment, it's a kitchenette versus a full kitchen. A kitchenette, which would include a countertop, cabinets, a sink with running water, a refrigerator, a microwave, things of that nature. And the reason that it's a kitchenette versus a full kitchen is that in assisted living, your base rent gets you 3 meals a day. Okay, so you don't necessarily need to supplement the dining room experience with a meal prepared by yourself in your apartment. So what else does that base rent get you in an assisted living apartment? Same things as your IL apartment, okay? Maintenance, housekeeping, utilities, Wi-Fi, all those things are continued. One difference, laundry is typically included in an assisted living apartment. Going back to the IL apartment, I didn't address laundry specifically. In some cases, there's washers and dryers in your apartment. If they're not in the apartment, they would be readily available, typically on the same floor as your unit, in order for you to do your own laundry. Okay. Now, so that's one piece of the cost. Second piece of the cost in assisted living is the cost of care. And that would be a function of an assessment that would be done of the residents that are moving into assisted living, where they really look at the totality of the help that somebody needs, looking at the full spectrum of all of the activities of daily living that they need help with. Somebody living in apartment 200 may have a total different care package or plan than someone that's living in the apartment just across the hall. It really is personalized based off of what your needs are. And different properties get there differently. Some have levels of care, some have point systems. Essentially, it's really a function of how much time do their caregivers need to be with that resident in order to keep them safe, to be able to get through the day safely. Okay? So some other things, both in independent living and assisted living, there are nurses in the building. Okay? Typically the nurse, and oftentimes the nurses are there 24/7. Not necessarily in all cases, but in many cases. There's therapy agencies in the building. So if there's a need to have physical therapy, occupational therapy, typically paid for by Medicare Part B, that those services are readily available in the building. There are doctors that make rounds. Oftentimes these are gerontologists, general practitioners, could be audiologists, podiatrists. I've seen dentists that come into the building. Okay, so essentially, if you need some help from a doctor or a nurse, that assistance and support is right there in the building. All right, let's keep moving. So now, talk a little bit about memory care. Okay. If someone is starting to show some cognitive decline, and perhaps there's been a formal diagnosis of a dementia, could be Alzheimer's, could be Lewy body, could be vascular. There's quite a variety of different types and diagnoses. Memory care could at some point be needed. A lot of times they'll get asked by the adult children. They'll say, well, gee, mom was just recently diagnosed with dementia. We need to move her into memory care. Not necessarily. Okay. There are many, many people that are living successfully in assisted living with some level of cognitive decline. But in some cases, memory care is appropriate. So how does memory care differ from assisted living? Typically, your apartments in memory care are studios versus larger formats. The reason for that is that the residents really are not in their apartment very much. The apartments are more for sleeping and for taking care of, shower and toileting purposes. Most of the time they're out in the common area with the caregivers, with the other residents, being active, being stimulated as much as possible. Typically your memory care area could be a separate building on your campus. It could be a floor that's been designated as memory care. They're typically secured, so residents cannot, easily leave the property. And that is really one of the key elements to help determine if someone really needs to be in memory care. If someone's showing escape tendencies and are exit seeking, then that really becomes, memory care becomes more of a priority and more important. Some of the other differences with memory care versus assisted living, the programming is very different. It's really geared towards people that have that cognitive deficit, and the programs are designed and the activities are designed so that the resident is going to be successful, that they really can participate. It's typically a quieter setting. There's more caregivers per resident in memory care than you find in assisted living. The caregivers in memory care have received special training. Okay, they not only to become a part of that property to start, but it's ongoing training, so they know how to work and deal with people with those cognitive shortfalls. They understand how to deal with behaviors, how to manage that. So it's a very different setting than what you might find in assisted living. And then going back to the actual format and structure of a memory care facility, there are properties that have both assisted living and memory care on the same campus, if you will. But there are also memory care operators that have standalone buildings that is what their specialty is. That's all that they do is memory care. All right, let's keep moving. So who's heard the term CCRC or continuing care retirement community before? Okay. So a CCRC is a senior community that essentially has all of the levels of care that we've spoken to: independent living with services, assisted living, and memory care. And we're going to talk about skilled nursing in a minute, but also skilled nursing. And typically your CCRC properties are associated with the buy-in type of financial model that we spoke to on the first slide. So a CCRC, more often than not, is going to be a buy-in type of community. And so when we talked about buy-ins and some of the benefits that you can migrate from one level of care to the other and stay within that same community, this is really what we were talking about. You go from independent living to assisted living to memory care, potentially skilled nursing, which we'll talk about that in just a minute, okay? So the next type of senior housing I want to speak to is supportive living. So supportive living, anybody heard of supportive living? Okay, somebody back, okay, oh, we have two. Okay, you guys are duking it out for being best in the class, okay, with the answers. So supportive living is a unique type of senior housing to the state of Illinois. It's for seniors age 65 on up. Residents have their own apartments, could be a studio, could be a one bedroom. They come with kitchenettes versus full kitchens. Very similar to your assisted living apartment from the standpoint of it's unfurnished. You have a base rent, which takes care of all the things we talked about: laundry and housekeeping and maintenance and local transportation and utilities and Wi-Fi and all of that good stuff. All right. Also included in your base rent is cost of care. So it's an all-inclusive type of setup. So there's no separate cost for both care and for the rent. Now, here's some distinctions. In supportive living, you need to be able to have a certain amount of physical dexterity. So for example, you need to be able to stand and to pivot on your own, even if that's to get up, to get to a walker or to a wheelchair. Essentially, you need to be able to navigate your own apartment to get to the restroom to take care of your toileting needs. All right, so that's a distinction from assisted living. So in the whole scheme of licensing, you have hospital, you have skilled nursing, you have assisted living, then you have supportive living. It's a licensed property, but it falls one level below what assisted living can do. So that's one big difference with supportive living. The other big difference with supportive living is that you're able to apply for and transition to Medicaid, and Medicaid can be the payer for you to stay living in supportive living, as long as your physical needs fall underneath the umbrella of what's appropriate to be there. So that's different than the other types of housing that we've spoken to before. These are all private pay only options. So Medicaid cannot be a payer in your more traditional assisted living, memory care, and independent living properties that you see out and about. Clear as mud? Question? Yes, that's a great question. So a question from somebody in the audience was, where does Medicare come into play in all this? Medicare doesn't go away. Okay, so Medicare, no matter where you're living, Medicare is still there. It's taking care of your hospitalization, rehabilitation, skilled nursing for rehab, medication. Medicare is still there. Even if, so Medicare is still in play, which is what the question that was posed. Well, you could, okay, but so a question was a follow-up question about Medicaid. There's really two, I don't want to get off too much of a tangent, but there's really two types of Medicaid. There's Medicaid that can be health insurance, so similar to Medicare, but then there's also a separate Medicaid, which helps pay for long-term housing. They have the same names, but they have two totally different purposes. Okay, I'll follow back up with you a little bit later on that. Okay, thank you for the question. So that's supportive living. And one thing that I forgot, one comment I wanted to make that applies to all of these types of housing. If there's a couple, and there's two people that are going to be living in the same apartment, there's what we call a second person fee. All right. And so in a sense, it's a cost of food, but I wanted to get that out there, so that in assisted living, if you have two people living in the same apartment, there's really three elements to the cost. There's the base rent, there's the cost of care, then there's the second person fee that comes into play. Just touch briefly on affordable senior housing, spoke to that, initially, and that, again, real short supply, seniors only, typically no services. These are independent living apartments. So there's typically no there may be some programming and activities, but not as much as you might see in some of your other senior properties, and really geared towards seniors that, financially may not be in a position to live in some of these other areas, other types of housing, but affordable housing could be a great solution for them. Then finally, skilled nursing for rehab or for long-term. So people can live can be in skilled nursing for, basically three reasons. Okay. One short-term, you fell, you injured your hip, you were in the hospital for three midnights. You're now appropriate to move into skilled nursing rehab to be paid for by Medicare. So you transition there for, 2, 3, or 4 weeks, get rehabilitated, and then you move back to where your original house was. You could be there for long-term. You can be there long-term for a couple of reasons. One would be that the level of care that you need falls outside the guidelines of what's appropriate to be in assisted living. Assisted living can be a great option for the vast majority of the people out there. There's just a handful of reasons why someone is not appropriate to be in assisted living. So that's things like you're on a ventilator, a respirator, a feeding tube, you're bariatric with your, a +2 person assist for transitional period. You're on an IV, you have a level 3 or 4 wound. If you're dealing with something like that, that has to be addressed in skilled nursing and can't be addressed in assisted living. Boy, there was another point I wanted to make about assisted living. Oh, I'll come back to that. And then the other reason that someone might be in assisted living or in skilled nursing long-term is because financially they no longer are able to afford private pay assisted living, and they're not appropriate to be in supportive living because their needs fall outside the guidelines of what supportive living can do. In that particular case, they need to transition to skilled nursing and to find a Medicaid bed in a facility that would be appropriate for them and to give them the help that they need in order to get through the day safely. And one thing I forgot to mention too, it goes back to earlier, senior housing can really be, assisted living or memory care can really be an end of life option for families, because you can bring hospice in. Okay. And so it's not necessary that at the end stage of somebody's life, when they really need a lot of help, to now go ahead and find a hospital or a skilled nursing property for them to take care of their needs at the end. Hospice can be brought in, and hospice can handle more complex issues than if somebody was not on hospice and living in assisted living, if that makes sense. Okay. So let's move on. So now you're in this arena of thinking about senior housing. So what are some of the things that you need to consider? Location is really important, right? Variety of issues surface with location. Mom and dad moved to Florida after they retired, and now they're in their mid 80s or early 90s. Life is changing for them, and they need to come back closer to the kids. Or the location where they live right now is where they want to stay, but they want to stay in closer proximity to where that original house was, where they've been living for 40 or 50 years, and they want to be close to their, to shopping, to their churches, where their family and friends are, so they can come and visit. And so location is really, usually a pretty key top 1 or 2 items to consider when looking to make a decision. Level of care, what kind of health services are available? Really important. Okay. And it's hard because you're kind of having to look around the corner about what's going to happen. And for none of us, we don't necessarily know what that maybe look like. But, if somebody is, let's say somebody has early onset dementia that's been diagnosed, all right, to move into assisted living that maybe does not have that memory care option right there, could be problematic at some point down the road, where all of a sudden now memory care really is needed. And now instead of just maybe transitioning to a memory care option that's right there in the same property, now you have to pick up and maybe totally relocate, somewhere else. So, none of us have a crystal ball to know exactly what's going to happen, but that is something that you need to kind of keep in the back of your mind. Lifestyle and amenities. What do they do for fun? Senior housing is the next step in someone's life, so this is where you're going to continue living. So what kind of activities do they do? What are the events when they go out? Do they go to plays? Do they go to movies? Do they, go out for dinner? Do they, what kind of activities in the building are there? Maybe you're a card player, and maybe this property has some really avid card players in the group. So you really want to go somewhere that you can continue doing the things that you've always loved to do. And now maybe also to be able to do some things that maybe you've never had a chance to do. And now because you're in this, environment, it's going to be a little easier for you to do it. Cost, cost is always a factor, right? And so, not only what the cost is today, but what's the cost look like down the road? So maybe you're starting out in an independent living apartment, you should at least have an idea of what in that community, what does assisted living cost look like? What does a base rent for a 1-bedroom apartment? What are the various levels of cost for the different levels of care that someone might need. Just from a budgeting standpoint, to kind of give yourself an idea of what that might look like, down the road. Who likes to eat? Okay, there you go. So food is an important criteria. And in all honesty, the food in senior housing is pretty darn good. Okay, it's prepared on site, almost all 100% scratch. They really listen to the residents to have their menus geared towards the things that they like. Menus change with some rotation. It's served in a restaurant, in a dining room restaurant style. So you have a menu. You can pick the items that you want. There's a lot of choice, and so again, so the food is pretty important. I remember I was working with a woman named Donna several years ago. Donna was 94 years old, and we were going to go look at some senior options for her. And so before we left, Donna goes, "Well, Rick, how's the food at the places that we go?" And I said, "Well, it's pretty good, Donna. Why are you asking?" She goes, "Well, when you get to be 94, you don't have much else to look forward to. So the food is an important component." Kind of touched on this already, activities and outings. Local transportation can be important, right? Is it available? Is Tuesday's Target Day? Do they go to Walmart? Do they, can they address your medical appointments? Can they get you to doctor's appointments? So perhaps the family member doesn't necessarily have to provide that for you. So what is the local transportation solution that they may have? I've worked with families where their loved one needed dialysis 3 days a week, and so was that an option for them to be able to accommodate that transportation within the building, or did they have to go outside and arrange, private transportation to get back and forth to dialysis? Staff, what's the staffing levels look like? Important questions to ask. How long has the team been in place? How long has the executive director been there? How long has the key department heads, director of memory care, director of assisted living, director of nursing, how long have they been there? The healthcare industry, does have a history of turnover. Okay. And so I think sometimes it's an indicator that stability can be an indicator of a really well-run organization. People change, doesn't necessarily mean they're leaving anything that's bad. They may be going somewhere that's good, but it's good for you to have an idea. How many of the employees of the caregivers are their own employees? Do they have to rely on outside agencies, to supplement their staff in order to have the proper levels of care? These are all fair questions to ask, because as you're looking at multiple properties, you can compare and contrast, what the differences are. Yeah, so a question that was raised from the audience was, sometimes, especially now, more recent with the labor issues that we're facing, more and more properties are going to have to rely on staffing agencies to supplement. If you need, I'm just going to say, if you need 40 caregivers to manage your building, and now you're down to 30, well, you may need to bring in 10 from the outside on a short-term basis, but that's good to know, right? If that's the case. So buildings and grounds, when your visit, if you're going to look at some senior housing properties, begins the moment you pull into the parking lot. Okay. Yesterday and the day before yesterday, right? Well, how did they do with the ice? Is it well salted? Is it cleared out? In the summer, how well is it landscaped? Are they, are the flowers in good shape? Are they mowing the lawn? When you're walking through the common areas in the building, is the building well lit? Is the carpet clean? Is it in good shape? Does it really need to be replaced? Things of that nature, because this is going to be your new home potentially, and so you really want to make sure it's in good shape. Yes, ma'am. So the question was about the furnishings of the apartment. So in independent living and assisted living, almost universally, they are unfurnished. So the resident moving into the apartment, you're going to either buy new furniture or bring furniture from home. They're going to decorate it with their own tchotchkes that they're familiar with. Going to put family pictures up on the wall. You're going to make it your home as much as possible. That answer your question? Oh, gee, how did food get in there again? Oh, because I really enjoy eating, so I thought I'd put it in there again. Security and safety. It's good to have an understanding of what when are the hours of operation for the building? When is there a concierge at the front door? What are the hours there that you can come and go? Typically, even when the doors are locked, you can still come and visit your loved one, but it's a matter of what's the protocol for that building. Is there a phone number you call? Do you ring a doorbell and one of the caregivers or the nurses on staff are to come in and let you in the building? And then I think it's good to ask questions sometimes about, what do they do about emergency situations? Do they practice what happens if there's a tornado drill, or some catastrophic event that's impending? How do they address that? And then future needs addressed. That kind of ties back to the level of care, second bullet, to the degree that you can, you really want to make sure that this really big, important move is the only one that you have to make. You don't have to make multiple ones, that you can stay there for as long as possible. So when is it time to move? I get this question asked periodically of me by adult children that I work with. Quite honestly, it really varies dramatically from one situation and one family to the next. What's important to you may not be as important to you, right? Sometimes it's almost always driven by safety. Okay, that someone is. I tell the adult kids that if you're waking up in the middle of the night wondering, gee, did dad wake up, get to the restroom safely and get back to bed, or did he trip and fall and is he laying on the floor? And so those safety concerns are well founded, and in many cases are really a key factor in people needing to make a decision to move. Family geography, we spoke about that before, that perhaps it's just important to get mom and dad closer to some family support, so that safety net is there. And then cost, right? I mean, sometimes, senior housing is not inexpensive, okay? But it's also expensive sometimes keeping somebody at home. We're going to talk a little bit about home care options, but sometimes that home care option, it costs more to keep somebody at home, to maintain the home, and all, property taxes and lawn keeping and all of that, then that becomes more expensive in many cases than a suitable replacement in senior housing. So senior housing today, virtually all buildings are open for business. We went through a period of time when visitation and family tours and being able to check out options was really restricted. It's pretty wide open right now. I mentioned the assessment process in order to determine if someone's appropriate to live in assisted living. That's being done more often than not face-to-face, but there are virtual options if that's what you need. Move-in process, there may be some protocols in place in terms of how many people they'll allow in the building for a period of time in order to facilitate the move. Resident isolation is virtually eliminated at this point. If there is a COVID outbreak in the building, that will be addressed appropriately. But the days of when someone first moves into a property where they have to be isolated for a period of time, as long as they've, had their vaccines, have been boosted, have a recent negative COVID test, they can move in and have full reign of the property. Family visitations, pretty much normal now. You can come and go as you please. You can bring mom and or dad out of the building and not have to worry about any isolation when you bring them back in again, which was not the case, a year or so ago. Employee and resident health is monitored, regularly. I can tell you that virtually all buildings are way over 90%, fully vaccinated, both on the staff standpoint and from a resident standpoint. And there's ongoing testing that takes place to make sure they identify people that do have the virus. Used to be for a while that meals were served in their rooms. There were no activities. And if there were any activities, they were kind of done in the hallway. Those days are pretty much behind us. I mentioned this already. And, if you know what's going to happen down the road, please let me know, because I don't have a clue. All right. As Omicron, hopefully it's going to go away here in a little bit, and the numbers are going to recede. But, the good news is today, there's so many people that are vaccinated. It gives us a lot more flexibility to maintain a more routine, normal way of life than it looked like a year and a half ago. So what kind of payments are accepted? Private pay for your independent living, assisted living, memory care, and supportive living. Medicaid and public aid. Two different options, for long-term housing. One is supportive living, which we spoke to, and another would be public aid, Medicaid, bed, and skilled nursing. So in the state of Illinois, that's where Medicaid comes into play as the primary payer for someone to stay living, whether it's skilled nursing long-term or in supportive living. Medicare, thank you, young lady in the back, bringing that up. Medicare is still in place. It's not going anywhere. Okay, so it's still there as your primary provider to pay for the healthcare needs of an individual. So how do I go about funding these payments? Social Security income, pension. If you were blessed to have worked for a company that had a pension program, now is the time, that those monies can be redirected to pay for senior housing. Savings and investments. If you've been fortunate enough to been in a position through your life to set money aside, now's the time to maybe tap into that. I remember, actually, it was right here in Elmhurst. I met with a gentleman several years ago, and me and one of my coworkers, and about relocating to do assisted living. He needed to move closer to Huntley, where his daughter was, and so he lived in a nice, modest house in Elmhurst. And the person I was with was really probing him about his financial situation. And so he asked about his income. He says, "Oh yeah, I make about $4,500 a month." They said, "Oh, that's great." And he said, "How's the house?" "Oh, it's all paid for. It's worth, maybe $300,000. So that's great." Come to find out, he has a long-term care policy, like a Cadillac policy, to help pay for senior housing. And then she said, "So do you have any money set aside?" And he goes, "Yeah, I do. I've got some, decent amount of money set aside." And she kept probing, and I'm like, "Oh, Nancy, why are you asking all these questions?" But anyway, and so she said, "Well, about how much money do you have set aside?" And he goes, "Oh, about $1.8 million of stocks and bonds and investments." And she goes, "Holy cow." She goes, "Boy, are you lucky." And he looked at her and goes, "Luck had nothing to do with it." So, which is true, right? Doesn't happen by accident. So he was in a position to be able to save, and he did save. Proceeds from the sale of your house. You've done a great job of maintaining your home. You've lived there for a ton of years. The mortgage is gone. Now those proceeds can potentially be used to help pay for your senior housing needs. Who in the room, does anybody have long-term care policy? Good for you. You are in the rare small percentage of people that I work with that have long-term policy. That if you have anything, that's fabulous. For the others in the room and the others in the audience, if you're younger and you're in a position to be able to explore it, now would be the time to do that, because as you age, the cost of that long-term care policy continues to escalate. But long-term care, most properties accept it. There's different, hold periods, in terms of before a benefit can be put into place, but long-term care can be a really great investment, in terms of paying for your care down the road. Veterans benefit, any veterans in the room? So if you're a veteran, there's some great benefits out there for the veteran himself. He or she can receive up to 12 hours of home care, paid for by the VA. There's another benefit called aid in attendance, which is eligible for both the veteran and the surviving spouse. There's some hurdles, for eligibility, but as aid in attendance can be help pay for, it's a monthly stipend. They can help pay for home care and also for senior housing. I think for a couple, the veteran and a surviving spouse, if they both were, if they became eligible for aid and attendance, I think the monthly benefit could be like $2,300 a month. So there's some nice monies available for that. Lines of credit to tap into that equity if the house is tied up and you need to get at some of that money, in more of a urgent matter, you can try to do some sort of a bridge loan. If anybody happens to have a whole life policy and you've accumulated some cash, some of those policies are now, there's some convertible pieces that might, maybe convert that into some sort of a long-term care policy. I don't know a lot about it. In fact, what I just said is about all I know about it, but your insurance agent, more well-versed on that might be able to answer your questions on that. And then, well, I don't know about you, my kids aren't not going to be helping me, but perhaps someone else said. Yes, ma'am. Yeah, you know what? I need to add that. So question from the audience commented about that, maybe add reverse mortgages to this. So if you're not familiar with reverse mortgages, it's another way of tapping into the equity of your home. And you could have a whole presentation on reverse mortgages. So I'll just leave that at that. Thank you for bringing that up. I appreciate it. So other items of importance, talked about veterans benefits already. When I'm working with a family, that's always one of the first few questions that I ask, is someone a veteran? Because most of the time people are not familiar with the benefits that may be out there. Elder law and estate planning. If at some point you think you're going to need to transition to Medicaid, getting an elder law attorney involved to help plan, that the movement in that direction. Sometimes there's just some elder law issues that need to be addressed. I was talking to a woman this morning, pretty complicated matter, in terms of the situation that she was speaking to me about. And quite honestly, it needed she needed the involvement of an elder law attorney to figure out what maybe not what the right step is, but to understand what her options were, and sometimes the elder law attorney can help with that. Is a power of attorney or healthcare directives in place? How many different types of powers of attorney are there? Do we know? There's two. Okay. There's a power of attorney for healthcare and there's power of attorney for property. Everybody should have one of those in place. Even if you're younger and you're sending your kids away to college, you should have a power of attorney in place for your children because they are now adults if they're over 18 years of age, and there may be some issues with communication for healthcare situation that might pop up. Your daughter's five states away, and they may or may not be in a position to share information that's going on with her. So having that power of attorney in place is important. Power of attorneys are documents that are utilized while someone is still alive. Okay. If at some point they lose capacity or they're no longer decisional, then the trustees that have been identified on the POA come into play to make decisions on their behalf. Talked earlier about the house that someone's living in. Perhaps they need some real estate services. Who's got stuff at home? I got stuff, right? But there's some wonderful services out there that can help with the downsizing, dealing with the stuff. If you need to move, packing, and you don't have the wherewithal yourself or family members to do it, there's some great companies can help assist with that. In-home care, let me just touch on that briefly. I'm a strong proponent of people aging in place and staying at home as long as possible. My own mom is 92. She's still living in the original home out in Elgin. And so if and when, the first step for her is going to be bringing some help into the home. And so these are private caregivers. The people that I work with are work for the licensed agencies by the state of Illinois. It's their own employees that are the caregivers. They've been trained, they've been background checked, drug tested, have appropriate insurances taken out on them, and they're non-medical support. Okay, they do all of the activities of daily living items that we spoke to from a personal care standpoint. They can also do things like just be a companion, run errands, do shopping, meal preparation, light housekeeping, pretty much whatever you can cobble together, to help, get somebody through the day safely. Adult day services are also great options. Virtually every town in our area has some sort of an adult day service option for someone to, have mom and or dad go there through the day and to get activity, get stimulation, lunch, things of that nature. And so how do you go about finding these types of communities? You can do the looking yourself, rely on family and friends and their input and guidance. There's this thing called Google. You can go out on the internet and just search. There are some specific websites for senior related items. There's also some online senior service placement agencies. And then there's also local senior placement companies like Senior Solutions. So let me just give you 30 seconds, advertisement for what I do. I'm a matchmaker. Okay. And so I help families understand what their options are based off of what their circumstances are. And so mostly in the senior housing arena, but also home care, elder law, and the like. I try to connect families to the options that make the most sense based off of what's going on in their situation. My services are free. There's no cost. My compensation comes on a referral basis from the senior properties that I work with, which is really the vast majority of them. And I'm gonna have my contact information up here in a minute, but I would, strongly encourage that, if you have any situation that's going on, feel free to give me a call. I'm happy to listen, give you whatever guidance and counsel I can offer. So again, here's my company name, my website, my email address, my phone number. For those of you that are here in person, I do have my brochures on the back table if you want to grab one of those on your way out. And so, Sue, do we have any questions?
So let me just really quick, if I am going to be launching a poll for our online viewers. If we do have any questions here in person, we do need to use the mic so that people on their devices can also hear your questions. So if you give me just a moment, and for online, if anybody has any questions, please go ahead and type them in.
Thank you. For the independent living or independent living with services, well, actually with independent living, is the rent typically increased every year or?
No, so the good question. So the question is just repeat, Kate didn't hear. So is there a cost increase to the base rent with independent living with services? And it's not added to your rent, but there's a separate fee for the services that are brought to your apartment. So let's say it's a shower assist. And so you need someone there for an hour, 3 days a week for the shower. There'd be a cost attributed to that. Yeah, in independent living. Oh, no, then there's no additional cost. It's just the base rent for the apartment. I now I understand. Yes, there's annual increases. Typically in my 10 years doing this, the increases have averaged about 3 to 4% on the base rent. Sorry, I misunderstood your question. Yes.
I'm just curious, were you in what your background is that makes you qualified? I've never heard of senior housing assistant or matchmaker. So I'm curious if you were social worker,
No, I was never a social worker, I was with a lot of retail organizations. And so I do not have a real healthcare background, but I've been doing this for 10 years and, it's kind of the school of hard knocks, and really spending a lot of time in the different communities. So I know what the pluses and the minuses of them are. And so I can get some guidance to the families. I've kind of become a social worker, by happenstance as I listen to situations and try to understand and give them, some of the wisdom that I've attained over the last, 9+ years.
And you don't charge for your services.
Correct.
You said you work on commission from the
Yeah, so
institutions.
you can question and answer me to death. I'm never going to give you an invoice. So if you were to move into senior community A, and I introduced you and helped schedule a tour and accompanied you and help make sure all the right questions get asked and answered, and you or your loved one moved in there, they would compensate me for that activity.
Thank you. And just last question. I hate to keep harping on the Medicare, Medicaid, but each institution, I would assume, has to take a certain amount of non-paying, meaning people who are dependent on the state. So they've got Medicare, maybe Social Security, and then Medicaid would kick in. Are they or not? Is
No,
that not
because
true?
in the world of private pay senior housing, there's no requirements for them to have a public aid element of their residents because they don't take Medicaid. So in Illinois, there's only two instances where Medicaid comes into play for long term. It's going to be in supportive living and then also in skilled nursing. Yep, you're welcome. Yes, ma'am.
My mom is in a medical unit with advanced Parkinson's and Lewy body and all of the stuff that goes with that. And I've not heard of the difference between supportive living and assisted living. Supportive living is not a medical unit and it's not assisted living. So
It's not what? I'm sorry.
supportive living, I've not heard of that term before.
Okay.
Is that my mother's in a progressive unit in Evanston,
Okay.
Presbyterian Homes, Highlands. And I didn't know that that was even available because
Yeah,
she went
support-
right from assisted living into a medical.
So
skilled.
supportive living has been around for probably 15 years at this point. And one of the key differentiators is that, not everybody's appropriate for supportive living because supportive living has a cap in terms of the amount of care that they can offer to their residents. Whereas assisted living is true 24/7 care that's not supportive living.
So which is the more limiting?
More limiting is supportive living.
Okay. Okay, thank you.
Okay. And I can answer another question for you afterwards if I
Okay.
can clear that up for you. Okay.
I have another question.
Pardon?
I have another question.
Go.
She's been in this facility for a good 10, 12 years.
Okay.
And so I've heard many stories sitting at the dinner table with a lot of fellow residents. And they've talked about how their husband died, but they couldn't reduce the amount that they had to pay. They still had to pay for a meal. They still had to pay for 2 people. They complained. And then they said, well, then you just have to move to someplace else. So there's not a lot of, at least in my small experience, of their being sensitive to the changing situations that some seniors get involved in or find themselves in financially. I mean, it's their way or it's no way. Am I being cynical?
No, I think that, depending, I hate to use the word depends, but it really depends. Okay. And, if someone can no longer afford to pay where they're at right now, then it's a matter of doing a hunt to see what skilled nursing properties in the area of your interest are open to accepting Medicaid. And I can help give some guidance along those lines.
Well, fortunately for my mom, she chose well.
Okay, good.
So she has a lot of support.
Super,
Yeah.
super.
But
Great.
this is just people who are out there talking and questioning and wondering, how do they handle the increases that have gotten quite
It's
extensive?
tough. It's tough.
It's very tough.
Yep.
And I find it interesting that you really do support staying at home. You know, my husband and I are not quite there,
Right.
but we think about it.
No, absolutely. I think, you know, the average age in assisted living is about 85 years old. So people are
Really?
staying home. Yes.
Oh, Tom, we've got some time.
Any other questions that you've,
Nothing online. If anybody has any questions, they can type this in. There's also, I'm sorry, I should have said it earlier that this program is also being recorded and will be available on YouTube in the next couple of days. Anybody who is registered, whether in person or online, will receive a link to it. So, another one.
I've also heard that if you're thinking of going into retirement community, that you should go in before you actually need it, to give yourself a couple years to know the system, know the people. And I know that's been very helpful for my mom because she knows a lot of people. And in her day, she would pull some yings to get what she needed, but
Right.
that was part of it. So
No.
I don't know if that's true or not.
yeah, I mean, you know, the way I usually describe it is, you know, you try to avoid the crisis, you know, try to get somewhere before the big event takes place. So to your point, that you become familiar and comfortable with the staff and the other residents, and to the degree that you can be ahead of the having to do something with your hair kind of on fire, you know, that I would certainly strongly encourage that. You know what, if I did, I wouldn't be here. If I knew that, I wouldn't be here.
You had talked about long wait lists with the low income affordable housing. How long are you talking?
You know, it could be 6 months, could be 3 years.
Okay, so then does that kind of go with what we were just saying, that maybe you should look at things like earlier than needed, especially if
Yeah,
you're
you
in
know,
that?
I think, you know,
lower
when someone
income.
approaches me about affordable housing, you know, I encourage them to get on the wait list, you know, because the clock doesn't start ticking until you're on the wait list. And even though it may sound like it's imposing, it can maybe go really quick because they start calling, you know, well, Mrs. Smith, well, I'm not ready. And you get to go on and on and on. And all of a sudden, what they think may be really, really long could go a lot quicker than you know. But unless you're on the list, you're not going to know that. Yeah, and then then they'll start over again. If you're not ready, then they'll come back to you the next time apartment's available.
Just about staying in at home, and
Yep.
you also help people with caretakers, is that right?
Yes.
And do you go through other home care agencies, or?
Yeah, I
you-
work with, you know, quite a number of agencies that I've become familiar with and trust. And so depending on the location, you know, I direct the family to the agencies that can really service them. So for example, I had a woman call me this afternoon looking for help for her aunt who lives in Wooddale. So I confirmed, you know, what properties what companies I work with service Wooddale, and I connected them. I live in Woodridge. Well, my office is in Woodridge. I live in Lyle. Sorry, but so I'm a half hour away,
It
but I'm
feels like,
very local.
it feels like you live in Woodridge.
Yeah, exactly. Oh, okay. Well, you know, I want to thank everybody for taking some time out of your evening, and appreciate the people that came in person. It was great being able to connect with you. And for those of you that are still online, thank you so much. And if you have any questions, you know, feel free to call at any time. Yes, exactly. Yep.
Thank you, everybody. Have a good night.